Oppositional Defiant Disorder is the topic. I'll refer to it as ODD in this presentation. And Oppositional Defiant Disorder, think of it as a teenage boy or girl with either very negative or very defiant type of behavior, also hostile, and mostly toward authority figures, so teachers or parents. And I'll try to give some very distinct symptoms and signs so that you can distinguish it from other personality disorders or characteristics, behavioral traits. So you have usually the cause as being a child or a teenager from a family that has adults that also have some sort of conflicts. That tends to be the etiology. Now, in terms of signs and symptoms, they say that you have to have at least 4 of the following 8 for a period of greater than 6 months. So I'll list the 8 so you can see what this is all about. So the first one that they talk about with ODD in terms of a sign or a symptom is losing temper. So the child or the teenager loses their temper very easily and repeatedly. The next one is arguing a lot with adults. The adult can be either the teacher or the parent, a lot of arguments. Defying adults also, the defiant behavior is another aspect. And the next one is refusing to obey rules. The next one is deliberately annoying people. Next one is, this is a big one, a lot of times it's on clinical vignettes, blaming others. They blame others for their own mistakes or their own misbehavior. Next one, easily annoyed, easily angered. I guess that kind of goes along with the first one. And then the last one I wanted to mention is being very spiteful or vindictive. So not exactly the greatest characteristics to have to be when you're a teenager, but this is an unfortunate part of ODD. What are the treatments? If you really do want to treat it, they have this behavior modification system. It's called reward-based behavior modification. And this type of a program is used to help change the child's behavior and make it more socially acceptable. So let's take a look at some clinical vignettes. I think these vignettes will help explain this in the best way. 15-year-old boy is referred to a psychiatrist by his school council and is brought in by his mother for increased hostility and argumentativeness with his teachers and toward his parents. He loses his temper and often blames his own classmates when it's his misbehavior causes him to receive punishment in class. He has done well previously with the schoolwork, has no history of theft, destruction, or of property or of physical violence. Which of the following most likely diagnosis? Again, it probably will be, there's a lot of overlap, to be honest. So it's going to be a little tricky sometimes, but some of these you can probably cross out, like he's most likely not mentally retarded because they say, hey, he's done well in his schoolwork. And then this one, no theft or destruction of property, kind of takes away conduct disorder. So I encourage you, check out the differential diagnosis for ODD, which of course includes ADHD. And the differential diagnosis is the key differences will be what's important in distinguishing ODD from the other types. So the answer to this question is ODD. The next one. A grandmother brings her 13-year-old grandson, who is in her custody, to a psychiatrist. He has been talking back to his teachers, not complying with school rules. When asked to stop, he gets angry, blames others, usually his classmates. In addition, his grades are deteriorating. The grandmother has been struggling with him in the past year and thinks he needs structure and control. The boy says she doesn't let him do anything and resents having to live with her. Psychological testing shows no evidence of a learning disorder. No indications. Which of the following is most likely diagnosis? Well, if there's no learning disorder, probably could rule out that, ADHD. The key thing that strikes me in this one is that he blames others, gets angry, and then he also has this resentment toward his grandmother, and that kind of goes along with oppositional defiant disorder. Last one. 14-year-old boy is brought to the office because he has been out of control at home and school for the past 6 months. Mother states that she can no longer handle his argumentative and annoying behavior. He refuses to do any of his assigned household chores, and he always replies to her requests with hostile and angry remarks. His teacher called the house last week to tell her that he loses his temper in class when annoyed and frequently blames his other classmates for mistakes that she knows that he made. Everybody is frustrated with his behavior, and they are concerned that he is only getting worse. A few years ago, they were worried he had a learning disability. However, tests failed to show any abnormalities. Most likely diagnosis is. Well, again, a lot of these losing his temper, being argumentative with adults, blaming others is definitely in there as well. And it's all a very good clinical vignette in my opinion, and I like how they say that his tests were normal. He doesn't have a learning disability, so you can cross out A. And a lot of these are psychiatric disorders, and you might say, well, what's the difference between conduct disorder and oppositional defiant disorder? By definition, ODD is actually considered a mild version of conduct disorder. Mild version of conduct disorder. So that's sort of the relationship. But fortunately for this 14-year-old boy, he has oppositional defiant disorder and hasn't progressed to anything more significant or severe.